So how did we get here? Childhood obesity did not happen overnight. And I've read where they say it's the perfect storm. And I've read where they say actually it's the perfect tsunami of things that have happened. So many things just have become out of our control. So we talked about not eating as a family anymore. More and more of our meals are eaten out. And it's a lot more energy-dense food, high calories and high fat. And we really have engineered that physical activity out of our daily routine. And I know from my house exactly what you say, that those video games, we're not playing that stickball outside anymore, but it's modern warfare in our basements. And unhealthy food is cheap and it's everywhere. And just in case you missed it, it's advertised to you everywhere. And we're drinking our calories over and over. And let's face it, the portion sizes have become out of hand. But it's all of these things. It's not just one, and it's more than just this. It's not just calories in and calories out, that our environment is continually bombarding us with messages, with food, with sedentary behaviors over and over. So Kentucky is one of the 12 states that are in the red, 30% obese, and we have another that's 30% that are overweight. So we have 67% of our adults that are either overweight or obese. And if you flip it, there's only 33% people that are of normal weight. That's just not a big number. So what does it take to flip it so that our maps start looking like 1999 or 1990? And I think it's what we've heard already over and over, but it's the coordination and the cooperation of many people. So it has to be at the federal level, it has to be at the state, the local, in our communities, in our churches. We have to have moms and dads ready to go. This coordinated vision, it has to be at the individual level, and it has to be at all of these different ones. The social ecological model really framed it to look at the individual, interpersonal, to make sure that the community connects along with the government. And the good news is that we are seeing progress in obesity. When I first started this job about 7 years ago, there was still a lot of things going on, and we were just starting to stem the tide of looking at policy and environment change. We were moving from the programs. And so in 2005, we had Senate Bill 172, where now we have healthier vending machines in our schools with high nutrition standards. We see more safe routes to schools, and then there's a lot of voluntary things that are happening. So we don't have the physical activity in schools, but there's a lot of creative things happening. And we see a lot of voluntary with the food industry. There certainly can be more, but it's a good start. We're also seeing support from the federal level. With the Healthcare Reform Act, we're seeing menu labeling that will come into effect in 2014, so we can actually see how many calories that we're ordering. The federal government has already put a procurement policy in place for their places of employment. So when you work in a federal building, you have nutrition standards of what can be served, and you have nutrition standards in the vending machines. And it's a great way to model of what can happen either in state agencies or in local agencies too. We have the Healthy Hunger Free Kids Act, and this is going to change nutrition standards in schools and child care. Nutrition standards from the USDA have not been changed for years, so this will be a very difficult change, but a very necessary one. We're also seeing more efforts to promote breastfeeding friendly, baby-friendly hospitals, where hospitals, the full staff is trained on breastfeeding is most important, that you go home trying to breastfeed and the formula is not the first thing that you try. And we're seeing a great deal of support from Michelle Obama with the Let's Move campaign. And they're having just put out child care recommendations that are voluntary for physical activity, reduction of screen time, and for healthy foods and beverages. Communities putting prevention to work has probably been one of the biggest public health prevention investments we've ever seen and that we'll ever see. $372 million was put in obesity alone. There was another big chunk of money to go for other prevention, such as tobacco and things, but $372 million just for obesity. And this went to every state. We received $462,000 at the state for this project, and then Louisville has received $7.9 million. And the purpose of it is to look at evidence-based strategies, put them to work, and then to evaluate them and see what works the best, and then spread them across the country. So we've done 2 projects with this funding. One is Farm to School, and we chose Farm to School because it seemed like it was the right time, that we saw a lot of schools already trying to do this and put locally grown foods. Plus, there's so many benefits. It's the local economy that it helps. It helps the local farmer have more markets to sell to, and then it increases the consumption of fruits and vegetables. And I've been questioned, why are you in public health in Farm to School? Isn't that an agriculture and an education piece? But really, when we put that food into context, and when children know where their food comes from, they are more likely to eat it. So what we've done at the state level is to build a Farm to School task force. And so we have the Department of Education, Agriculture, Public Health, and several other agencies to support us, like Cooperative Extension, UK College of Public Health, Action for Healthy Kids, Community Farm Alliance, Kentucky Youth Advocates. And so we're looking to find out what will make Farm to School the most sustainable and easy to do. We're also giving funding out to local communities. You'll hear from Lisa Sims later today on what they're doing in Davies County. And they're coming up with really creative things. We've asked for communities to work on a comprehensive approach to look at the 3 C's of Farm to School. So how do you get the food in the cafeteria? How do you get the kids an experiential learning experience where they get their hands dirty and in the dirt? And how do you connect the community so they know that this is important as well? The other project that we're doing with our communities putting prevention to work is looking at early child care, nutrition, and physical activity standards. And what we want to do is make sure that there are standards across statewide, so any child care that is in the licensing realm gets these high nutrition and physical activity standards. And this is a matter of equity. So it's not just the child care that is in a good neighborhood or has a lot of funding, it's all child care. So we want to see a limit on screen time, structured physical activity with role modeling from the teachers, and then to have the nutrition standards stronger. So we're providing a lot of training for child care providers. We've done several pilot projects. One right here that Don Crass was doing is the knapsack, and it stands for nutrition and physical activity, self-assessment, and child care. And the child care director goes and looks at their policies in their environment and sees where they can make stronger policies and environmental changes. Don comes in and he helps them and looks at things that they can change. There's a lot of education that goes along with it for not just that child care director, but their whole staff. And then they come back and they change their policies. It's a very tangible program. And then they can also change a lot of the environmental changes. When we first started learning about the child care realm, we said we can make these changes, but unless the parents also make these changes and are aware of what's important, we're not going to do anything. So that was what we decided was the 5210 campaign. And this is an awareness program for any caregivers of 2 to 5-year-olds. So parents, we'll see this in pediatrician's office, WIC offices, and early child care. And it's the evidence-based behaviors: 5 fruits and vegetables, 2 2 hours or less of screen time, 1 hour of physical activity, and no sweetened beverages. So we want this to be a layered message that you'll see it hopefully on billboards, on TV. These materials will be available to you soon. And they talked about Chris Bowling being a wonderful speaker. And if you want to hear him, he'll be in Frankfurt on November 3rd, helping us roll this out with early childcare policies. The other thing we did at the state was develop a policy agenda. This was Shaping Kentucky's Future, of policies to reduce obesity that was released in 2009. And there were 8 recommended policies, and almost every one of them have been touched since 2009. In this past legislative session, we've seen 5 bills go to the legislature at the state level, and just the first one was passed, which was establish a legislative childhood obesity task force. So there have been several legislators that have been appointed to this task force. They've been meeting monthly since June. They've been hearing testimony of what are the best things that we can do. And so by the end of the year, they should have a report of what should happen in Kentucky. And this is a really important thing for all of us to follow. For 7 years, we've had a physical activity bill to increase in schools. This year, there were 2 of them, one for 150 minutes per week of physical activity. The other one was for 90 minutes for physical fitness. Neither one of them went anywhere, so there's always again this year. The other one we talked about a little bit was the BMI surveillance, and this did not pass in the state legislature, but we do think it's going to go forward in the agency regulations and the program review. And so what this does is we ask for physicians to weigh and measure the child while they are in the office, put it on the physical exam that they're already doing, and this is for kindergarten and 6th grade, so that BMI percentile will be measured and sent to the school, put into Infinite Campus, a database that already exists, and then we will have aggregate data that will say what our county's data level is. And this was done in a rural county here in Kentucky with Infinite Campus, and what they found was it wasn't that 1 in 3 students that were overweight, but it was 1 in 2. So I really think this would be something that can really help us drive to our decision makers. There was also a bill to develop model standards for childcare. My committee has already done that, so we have that, but this bill didn't go together. And there's a lot of things happening at the local level. We're seeing more and more farmers markets to increase the access of healthy foods. And when I talked to the Department of Agriculture, they said we're actually reaching the level of saturation for farmers markets. It's not that we need more of them, but the ones that we have need to be visited better. And one thing that many communities are doing is adding the EBT, and so you can use your debit card, your WIC card, food stamps. And what this does, again, it's a matter of equity. So it's not just those people who have money who can go to the farmers market, but it's anybody. Louisville has done the healthy retail in school, in their communities. They started off with an assessment, and what they found was in their low-income neighborhood in the West End, there's very few people who have their own cars, so they rely on public transportation. And in those communities, there's not full-service supermarkets. And so they didn't have a place to get fruits and vegetables. So they would go to their corner stores, and there would usually be onions, iceberg lettuce, and potatoes. But that was all they had to choose from. So with the grant, they did Healthy in a Hurry, and they cleaned up storefronts. They asked for them to take down advertising. They gave them a cooler, and then they also helped them get these fresh fruits and vegetables in. And it's been good for the community and for the retailer. We're seeing more and more communities develop pedestrian and biking plans. And I know one of my first field trips was to come here and go on the green belt, and Debbie Philman got us bikes and helmets and let us ride that. And they really saw that there was a great economic impact from that green belt. went in. And we're seeing it in all sizes of communities. In McKee, which is in southeastern Kentucky, they wanted to build a quarter-of-a-mile path around their playground. And they had 65 people come to support that quarter of a mile. That's how important it was to the community. And so they need strong champions, not just government leaders, but they need those local people in the neighborhood. 2 minutes. Complete streets, we're seeing more of this in rural areas as well, where everybody has the opportunity to be physically active. Supporting breastfeeding, and Anita's going to talk about that. One of the things I do want to talk to you about is worksite wellness. Teresa Lovely is our worksite wellness coordinator. She's gone and talked about the process of worksite wellness with many companies. And one thing that we've done together is a worksite wellness health impact assessment. And what we wanted to find out is, does childhood obesity have an impact? Do we have an impact for worksite wellness programs with childhood obesity? And what we're finding is that it has a great deal of impact. That parents can be supported at the workplace for their health and for their children's health, and that actually there's many companies already putting in place childhood obesity programs because they're paying for their insurance. And probably this last one is the most important. The worksites may be provided the best avenue for promoting health and environment by reaching the highest population in the state. We know that this is where the parents are. It's hard to get them when we try to go to after-school events and things like that, but we know that we can get them at the work sites. And really, there's a great role for public health and for businesses to work together and really let those businesses be the lead in your community. So it will take a tsunami and a perfect storm to get us out of this, like it got us into it. And the last thing I wanted to leave you with some of the most recent research that I've found on obesity. This came from the Lancet Journal, and there was a 4-part series on obesity, and this is what came out of it. It's not, the government leadership is probably the most important. If we keep doing what we've been doing, we probably are not going to help it, and it's going to be very expensive on our population's health and on our healthcare costs. And what I found interesting was that equation that we've been telling everybody, 35 calories in equals a pound. If you do this, then you'll see weight loss, but really it's much, much slower than that. And we talked about 10 calories per day, and you will see this in more of a year. So we really want to think about that when we say we're planning these interventions, and you'll see an impact. We need a lot of evaluation and monitoring so we can know what works. And of course, this system approach is the most important. And one of the commentaries on this Lancet Journal talked about the hedgehog and the fox theory, and obesity is where the fox is needed. So the hedgehog thinks about one thing and thinks about it well, but obesity is so complex and it has so many different factors in it that we need a smart fox that knows a lot about many different things. So be a fox.